Which antibiotic is best for your UTI? If you're wondering which antibiotic might be best for your urinary tract infection, it's important to know that the right choice depends on several factors. The type of infection, whether it involves just the bladder or has reached the kidneys, plays a big role. Your doctor will also consider local antibiotic resistance patterns, your allergy history, and any previous antibiotics you've taken. For simple bladder infections, known as cystitis, the usual first options are nitrofurantoin, trimethoprim-sulfamethoxazole, and sometimes fosfomycin. Nitrofurantoin is often the go-to because it works well against common bacteria like Escherichia coli and has a good safety profile. Trimethoprim-sulfamethoxazole can be effective but is only recommended if local resistance rates are low and you have no allergies. Fosfomycin is sometimes used as a single-dose treatment, which can be convenient. When the infection is more severe, such as a kidney infection called pyelonephritis, doctors might prescribe antibiotics like ceftriaxone, a third-generation cephalosporin, or fluoroquinolones like ciprofloxacin. However, resistance to fluoroquinolones is increasing, so their use is becoming more cautious. In some cases, especially if the infection is serious or the patient is hospitalized, intravenous antibiotics like gentamicin may be used. For complicated urinary tract infections, which occur in people with structural issues, catheters, or systemic symptoms like sepsis, treatment becomes more tailored. Doctors consider the severity, resistance patterns in the area, and individual health factors. They might choose broader-spectrum antibiotics such as third- or fourth-generation cephalosporins, carbapenems, or piperacillin-tazobactam. The goal is to start with effective broad coverage and then narrow down once culture results are available. It's crucial to remember that antibiotic resistance is a growing concern. Resistance to fluoroquinolones and some older antibiotics is rising, which makes local resistance data very important for guiding therapy. Treatment usually lasts about 5 to 7 days for uncomplicated infections and longer for complicated cases, often switching from intravenous to oral as the patient improves. Always consult a healthcare professional for diagnosis and treatment. They will prescribe the appropriate antibiotic based on your specific situation. Misusing antibiotics can lead to resistance and side effects. If you have bladder cancer or other bladder health issues, your doctor will consider those factors when choosing your treatment plan. In summary, nitrofurantoin and trimethoprim-sulfamethoxazole are common first choices for uncomplicated bladder infections. For more severe or complicated infections, broader spectrum antibiotics like ceftriaxone or other advanced agents are used. The key is individual assessment and careful selection by your healthcare provider, always guided by current medical standards and resistance data.